Good evening, everyone. It's Sunday, although it might not feel like Sunday to you. I know that all the days these days are kind of blurring together, and for me, it's a blur of emails and text messages and phone calls and Zoom meetings that just run from one day to the next. But it is, in fact, Sunday, April 5th, 2020, and I want to give you an update, first of all, on our current statistics in Sonoma County. So, starting off with the number of tests that we have administered. We have administered 2,409 tests to date. We have 107 total cases in Sonoma County. Of those, 83 are active, 23 are recovered, and sadly we have that still one fatality. Of these cases, a lot of people want to know what percent of people are being hospitalized. That figure is currently at 18%. Have required hospitalization, which means that 82% of the cases have not required hospitalization, and we're not that level of acuity that would require bringing someone to a hospital. We're still seeing that the coronavirus is spread fairly equitably around the county. Currently 17 in North County, 14 in South County, 15 in East County, 13 in West County, and 52 in Central County. And again, that's cumulative. So even though I said currently, it's really to date. So that's not the active number of cases, that is the total number of cases by geographic region. I've also got some statistics regarding the age range of the cases. We do have 4 cases positive in the 0 to 17 age range. We have 55 cases in the 18 to 49 age range. We have 33 cases in the 50 to 64 age range, and we have 19 cases in the 65 and up age range. Of the total world of cases, we're actually seeing more in women than in men right now. Currently, the breakdown is 54% female and 46% male. What's going on today in terms of news? What's the latest news out of the world, out of the county? I want to start off by acknowledging that we have our first confirmed coronavirus case in a tiger at the Bronx Zoo. Her name is Nadia. She is a Malayan tiger. That's really all I know about it. But I do think that brings up something very interesting, and a lot of people have actually asked me, what about pets and coronavirus? The answer is we don't know, but certainly if a tiger has caught it, it does provide some evidence of some kind of zoonotic spread. So I've heard a lot of veterinarians actually suggesting just keep your pets to yourselves, don't let your dog have a play date right now, and since we're all being sheltering in place at this moment, I think that's very good advice. We should try to shelter in place with our pets and try to make sure that they're not doing things going on a run and going and having a party with their neighbors. So other big news out of the county is the new health sort of suggestion to wear face masks in public. And when I say face masks, I really mean face coverings. We really want to reserve N95 masks and surgical masks for our medical providers. They are the ones who are on the front line their lives in order to save ours. But when we say go out with a face covering, it could be as simple as a bandana wrapped around your face, it could be a scarf wrapped around your face, or it could be something kind of fun and cute like this. A friend of mine, an awesome person named Amy, left this on my porch. I'm really looking forward to rocking the pandas here. I have seen a lot of memes going around social media regarding the ineffectiveness of cloth masks. And here's the thing. If you're going to put this on, right, and you're going to have a test tube full of aerosol coronavirus particles, and you're going to take, a hair dryer and you're going to blow it at your face, yeah, something's going to get through. But here's the thing. That's actually not the point of the face coverings, right? The face coverings, it's actually to keep your own sort of breath, right, close to you, to prevent actually your spit and your particles from going out and infecting someone else. So the face coverings are really to protect your neighbors, and that's why it's critical that everyone wears it, because this is the kind of a situation where you're only as safe as your neighbor's behavior, right? So whenever you're out in public, please do use a face covering. It's really, really critical. And, it's not a bad idea, especially if you're going to the grocery store, to wear gloves as well. I know Andy's, actually my husband made our every couple of weeks food provision run this morning out to Andy's in West County, and they're actually giving out gloves, which I think is a really, really great idea, so that you can put that on right as you're going in the grocery store. One last update before I go to questions, which is that we will have another virtual town hall on Tuesday at 7 p.m. I'll actually be participating in this one. It will be live streamed on KRCB, on their sort of TV, on their radio, and also on Facebook and social media. So check it out, and that will also provide some information and some updates from Dr. Mace, our public health officer. I also wanted to mention I've been working hard at enhancing communication inside the county, and we are working towards the point of getting to daily briefings with our public health officer, Dr. Mace. So stay tuned for that. I'm hoping that that will materialize in the next few days. But I know that daily information is really critical to everyone right now, and we're trying to get our experts on board with being able to provide that on a daily basis. So, all right, I'm going to go ahead and go to questions. I'm lucky I've got my husband here reading through the questions and the comments, and so I'm going to look to him and then repeat the question after he lets me know what's going on.
Ask people for questions.
If anyone has any question. Why does the video feed always freeze? I can't help with that one, unfortunately. Probably, I would say West County, internet reception is not the best. So, other questions? If you guys don't have any questions, I'll say goodnight. But here's a good question. This question I see coming in: are face coverings recommended when going out for walks along with essential errands such as shopping? Essentially, you want to wear a face covering whenever you might come into contact with other members of the public. And so yes, if you're going out on a walk and you're going to be going on a sidewalk, or on, the West County Trail or the Joe Rododa Trail that would be shared by other people, you do in fact want to wear a face covering. Just because even that incidental sort of exchange of air, even with the social distancing. And I also want to be really clear. So using face coverings does not mean that you don't have to social distance, right? You want to be wearing the face coverings and you want to be social distancing. And that is really the way that we are going to flatten the curve right here in Sonoma County. One thing actually, if you guys have an opportunity to go check out socoemergency.org and to go to our dashboard, you can literally see that we are flattening the curve in Sonoma County, right? So you can see when it was sort of rising more quickly, and that was before the full effects of our shelter-in-place order were actually being seen. And then you're actually seeing this leveling off, which is, really good. It shows that what we're doing and the sacrifices that we are making as a community are working. And so that's bearing out not only in the modeling that we sort of received those preliminary results late last week, but also in the actual data that's coming in on a daily basis. So that is very, very good news.
Somebody said, is hardwood flooring essential in a new rebuild? And I think they're meaning are there changes in the construction requirements?
So the question is hardware flooring essential in a new rebuild? So it was specifically a new rebuild, or
yeah.
So if this is if this is a fire rebuild, fire rebuilds are allowed to continue forward with the new shelter-in-place order. And I want to say that construction has been the most confusing thing about this new shelter-in-place order. I was actually on a phone conference with our county council on Friday, and we're going to be doing some outreach to the construction industry, so reaching out to labor, reaching out to the North Coast Builders Exchange, other sort of contractor, large contractors in Sonoma County to try to provide a little additional clarification, because that did actually change between the first shelter-in-place and the second shelter-in-place. And it did get a little more restrictive. But if you are working on a fire rebuild, you can continue working on that fire rebuild.
Okay, we have a lot of questions coming in. What is happening with the homeless right now?
What is happening with the homeless right now? That is a great question. So we are working very hard to stand up an alternative care site. In addition to offering 500 beds for non-acute COVID-19 patients and non-acute non-COVID-19 patients, there will actually also be a separate area where we can have homeless folks get into shelter. So we are looking at, single room occupancy type dwellings so that people can actually have their own individualized space. We are also actually proactively testing our unsheltered population as well. I recognize that our homeless population actually have a lot of co-occurring medical conditions. And so those who are 65 and older or who have a co-occurring or pre-existing medical condition are going to be prioritized for shelter. And that is thanks to state funding, and actually FEMA is going to be helping to cover some of that, the sort of bill that's going to be associated with that as well. We do recognize that we're not going to be able to shelter everybody because we have nearly 3,000 homeless residents in Sonoma County. For those that we can't shelter, we have already put out hand washing stations, porta potties, and we are working on food delivery. And I want to give a shout out because I know that Clean River Alliance has been offering food delivery to some of the encampments. And we've had a number of volunteers as well that are just making sure that people are fed. so that they can actually shelter in place where they are, as opposed to having to come into town to try to get supplies. So that is what is happening with our unsheltered population. There's still more work to be done, and I'm really hopeful that in the next day or two we will be able to announce where this alternative care site is, and we'll actually start to be able to see more people moving in. We do also have those 10 trailers, and they have been moved over to the fairgrounds. These are the 10 trailers that Governor Newsom offered up a couple of months ago, and so those are also ready and waiting for folks to move into them, and I believe that move is in process this week.
When should we expect more detailed demographic information about the people who've tested?
Great question. So this question is, when can we expect more detailed information about the demographics of those who have tested positive? And my understanding was that once we hit 100, that level of detail, so we'd actually be able to see what is the hospitalization rate by age range, for instance, or by geography, that information would be coming available. So I'm hoping that it will be up tomorrow or the next day. I know that actually it takes some time to go through every single individual case to get to that level of detail. And so that was something that our public health nurses and officers and epidemiologists were going to be working on very, very soon. So I will let you know as soon as I hear about it. We'll definitely share it on social media, as well as review that at future Fireplace chats.
Have you heard about the 2 cases in Guerneville? We heard about them yesterday. Have you been notified?
So this was a question about 2 cases in Guerneville and whether I had been notified. I actually do not receive notification about patient details because that is a violation of HIPAA. So I don't actually receive that from the public health department. However, I have heard about various cases in various parts of the county just from people who are friends of the folks who have tested positive. So I am aware of a number of cases, but I don't share that information because it is confidential information. And I think it's important to respect that patient confidentiality.
And the article in the PD said masks were not being provided to front lines. How do we get them to the people in the ICUs?
So this was an acknowledgement that the Press Democrat mentioned that masks were not always making it to those folks who are working on the front line, and the question was, how do we get them there? So this is something that I've mentioned before in past Fireplace chats, and it's a little frustrating because we have been able to source a number of masks and also gowns and also the face shields and goggles through our emergency operations center. But then we distribute it to the hospital, and ultimately it's up to the hospital to distribute it to their staff, right? And so unfortunately it seems that some hospitals are rationing PPE to their staff because they are concerned about a future shortage. But we are really, really procuring PPE in the County Emergency Operations Center, and we're actually working very hard to place orders for literally hundreds of thousands of masks. So hopefully that will happen in the next few days, and we'll be able to make that sort of public announcement when it's finally happening. But please know that we're working every day to try to source critical personal protective equipment supplies. And in terms of, trying to get it for frontline workers, if you know someone, right, if you have a friend who is a nurse or a physician, you can always give them, if you've got unopened, unused PPE, you can always give it to them directly. So unfortunately, we're kind of going through this, hierarchy, which is it all gets, consolidated and then it's given to the hospital itself. But if you've got a friend, there's nothing wrong with just going person to person.
Is ordering from restaurants by way of delivery still the safest way to go right now?
So a question about the safety of ordering from restaurants by delivery. There is guidance up on the socoemergency.org for how to decontaminate your food when it comes into your house, and so you can certainly follow that protocol. We actually just did our grocery shopping run this morning, and it was amazing how long it takes to unload your groceries when you are wiping down every single surface by hand before you put it into your refrigerator or into your cupboard. But similarly, you could also, apply those kinds of rules to, say, the containers that the food comes in or the bags that they come in. So that's what my recommendation would be with respect to ordering food.
I would like to know about cycling rules during the shelter-in-place order.
Question about cycling rules during the shelter-in-place order. Right now, our trails that are open, the West County Trail and the Joe Rodota Trail, are not supposed to be open to cyclists. They're supposed to be pedestrian only, and that was a determination of regional parks as part of the public health order. However, cyclists are still welcome to utilize the roads, right? And there's nothing stopping you from going for a bike ride on the roads, and it's a good way of getting exercise.
If the peak will be in 60 days, then why would we even think of lifting a shelter in place? How long should we plan to shelter in place?
This is a great question. So the question is, if the peak will be in 60 days, then why would we even think about lifting the shelter in place earlier than that? And how long can we expect to be sheltering in place? I think that's the question that nobody across the country knows the answer to right now, because it really depends on what kind of other mitigation measures we can put in place. I can say, I am not an epidemiologist, I am not a public health expert, but I don't think that it would make sense to lift the public health order before that peak occurs, right? Because what happens as soon as we lift the shelter in place order, then we're going to see another surge of cases as we see more human to human contacts and the transmission increases. So I do not anticipate seeing the shelter in place order lifted prior to the peak of the cases and sort of starting to come down. But there are a few things that could change that, right? Number one, we come up with some really fantastic mitigation measures that do not involve shelter in place. That could be something like the antibody testing. It could be something like mass thermal scanning wherever you go. It could be, obviously the one that we're all hoping for is actually a vaccine, although we know that that's going to take some time to come up with and then test and then mass manufacture on a scale that could be delivered across the country. So those are the kinds of conversations that are currently happening. Or at what point can we lift that shelter in place order? When is it safe enough? And then what are the protocols that we need to have in place to ensure that we don't see a resurgence of the disease? Because all of our financial suffering around the community, all of the sacrifices that we are making as a community right now will be in vain, right? If we just lift that shelter in place order and then you see a resurgence of the disease. So rest assured that those are all the things that our public health officer will be considering when she looks at how long to extend the shelter in place order and then what kinds of potential modifications could be made to that shelter in place order going forward.
It seems like there's a lot of questions coming. Who can get a test this week? Will symptomatic patients still be turned away because of lack of swabs?
Question is, will symptomatic patients still be turned away because of lack of swabs? Symptomatic patients should be tested, period. And that is the guidance of our public health officer. And our public health officer is actually asking all of our different healthcare providers to step up testing, including testing of asymptomatic individuals that are in high-risk populations. So we are actually proactively testing healthcare workers, first responders, folks who are at high risk of catching the disease because they are engaged in professions where they do have known exposure. So we shouldn't be turning away people, and if we are, that is definitely something that we need to know about so that we can take it up with the specific healthcare provider who is denying the testing.
Any news on when the second round of modeling will take place?
So the second round, this is a question of at what point will we get the results of the second round of modeling. The second round of modeling our modeler is working all the time for us. And so we don't know exactly when he will have the results of the next questions that we're asking. And some of the questions we're asking are actually, what would happen if we reopened the regional parks? What would happen if we reopened schools? We're trying to look at not just shelter in place, but different levels of shelter in place and also different timing for when the shelter in place order would be lifted. And so that will help us determine, how to move forward and when it would be safe to lift those shelter in place orders, or if the shelter in place order could be tweaked without endangering the community. So that modeling is ongoing, and I don't have a date, unfortunately, for when the second round of information will be released, but you'll have it as soon as I will.
Someone was giving a shout out to the CHP and sheriffs for enforcing stuff out at the coast and asked about if it could be possible to put up a big sign notifying people if they're coming for those reasons that they're in violation of the...
So this was someone who was saying thank you so much to the CHP and sheriff for enforcing visitors out at the coast, and then also asking about signs. And we actually did order signs, and they were installed very shortly to be put up primarily at the entrances to Sonoma County to remind visitors that we are in shelter in place in Sonoma County. So we actually do have signs ordered, and they should be implemented very soon.
Can we get a detailed breakdown of ages of patients 18 to 49?
This is a good question. The question is, can we get a detailed breakdown of the patients who are from 18 to 49? And I've always thought that was a very wide window, so I will definitely ask our public health officer if it's possible to have a breakdown that's a little bit narrower than that. When will you be opening parks and beaches? The question is, when will we be reopening parks and beaches? We do not have a plan to reopen parks and beaches at this time. However, I want you to know that Regional Parks Director Bert Whitaker and our Public Health Officer, have already been talking about when it comes time to open regional parks, what will be the mitigation measures that could be put into place. So there is a lot of contingency planning that is taking place. If, for instance, the shelter-in-place order is able to be lifted a little bit at some point, right? Maybe not a wholesale lifting, but maybe there are some things that could be tweaked. Could we do things like having people, park every other parking spot in our regional parks? Could we do things like, odd or even license plates, have different days that they can go to the regional park? So there are definitely conversations happening, but we don't have a firm date yet for when we could reopen the regional parks. And I want to acknowledge that it is a significant hardship on many not to have access to this outdoor space at this point in time, and that a lot of people really rely on regional parks for their mental health and wellness as well as their exercise. I think someone asked to see the mask again. I just saw that one kind of flashing by. So this is what this mask looks like. And I understand that this is the Kaiser design. So if you just Google Kaiser cloth face mask, it actually shows you how to make a face mask like this. It has these little sort of flaps and then little strings to be able to tie. And I've seen there are various designs floating around on the internet. And I actually am going to ask our public health officer if there could be potentially some guidance for best practices for making cloth masks. So I will ask that and I will get back to you.
Somebody asked if it was possible that wearing a mask could be made mandatory for people in public.
So this question was around whether wearing masks would become mandatory for those who are in public. And I think that one question is, will people wear masks anyway? I think it'll be very interesting in the next couple of days to see to what extent people actually are following public health recommendation to wear masks. If not, and if it proves to be a really substantial intervention, our public health officer might consider making them mandatory at some point. I have heard of some communities already taking that step, but for now we are just in line with the CDC guidelines, which is recommending that these masks, these face coverings, be worn.
I'm honestly just frustrated because I can't see all the old ones because we're not keeping up and I can't access them.
My husband's struggling a little bit because the questions were coming in so fast, so sorry. He's trying to find and trying to figure if he can look up and see where they are.
Somebody asked, if you have a recommendation for where to give handmade masks. They made 200 and then they were having trouble.
Oh, this is a great question. So a question about where to give away homemade masks. And it sounds like someone made a bunch of masks. There's actually an online Facebook group, and I believe it's called North Bay Sewists. And they are actually sort of sewing masks and then distributing them to those who need them. And it sounds like a really great group. I haven't gotten to learn too much more about it, but a few friends let me know about it. And it sounds like there's a lot of online organizing that's happening around the production of cloth masks. So check out, I think it's North Bay Sewists, and they might have an opportunity for you to be able to distribute your masks in need. I've actually just seen friends posting on social media, hey, do you need a mask? I can make them, and then just putting them in the mail, even sometimes for strangers. So you could try social media as a point of contact, and I will also follow up with our Emergency Operations Center to see if we have any kind of centralized cloth mask distribution for those of us. For me, I'm a terrible sewer. It would look like a disaster if I tried to make a mask. I would be wearing just scarves wrapped around my head if it weren't for my friend who has way better skills than I do. So I'm sure that there are other people like me who need help and would love to receive help from other members in the community. Other questions? And I'll try to scroll down as well.
Will the post office be able to remain open?
The question is, will the post office be able to remain open? Mail is an essential service, and I think that especially in light of the pandemic, it's an even more critical service where a lot of people are relying on mail and deliveries of even groceries, but also just essential household products. So the post office is definitely open. It's definitely considered an essential business, and I can't imagine the federal government shutting down the post office when it's a critical service. So obviously can't speak for the federal government, but that's my 2 cents. Other questions? Let's see. question about, I see one, we need N95 for our medical teams on the front lines. When are they getting them? We still actually have N95 masks available in our emergency operations center. So if there is a hospital or a healthcare facility that is in need that has not received them, please have them submit an order over to the emergency operations center. We can't control the actual distribution to the employees, but we can make sure that our medical facilities have what they need when they need it, and we are doing our best to do so. So we're trying to order more and continue to source more as we anticipate the surge in cases and with the expected peak about 60 days out. The good news with having a peak 60 days out is that we do have time to prepare. We're building out our alternative care site. We're trying to order all of the PPE that we possibly can, masks, gowns, goggles. We're trying to cover all of our bases, and we also are still actively working on sourcing swabs so that we can conduct more widespread testing. And we're investigating those more rapid turnaround testing opportunities as well. And there's some interesting information coming out of Italy with trying to work on antibody testing as well. And so we're have our ears to the ground to try to learn everything we can from other countries, from other states, and from other counties. All right, any last questions? All right, looks like there's some robust conversations going on. But if there are no more questions, I hope you all have a good night. And I will see you on this sort of forum next Thursday at 8:30. And I will also be on the town hall with KRCB at 7 o'clock on Tuesday. Oh, I see one last question coming in under the radar. Are we still permitted to go out for a drive without stopping or getting out of our cars? Or is this now discouraged with the additional measures? You really should only be driving or traveling for essential activities. So for things like going to the grocery store, going to the bank, going to an essential job, or an essential business. And so just sort of driving around is probably not the best thing to do right now, and not really in the spirit of the health order. I did receive a really concerned email from someone just over the weekend who had been stopped by a sheriff's deputy out at the coast just for going for a ride. So it does sound like some enforcement is actually taking place on this right now. The best thing to do, I know it's stressful, I know that everyone wants to get out of the house, but go for a walk in your neighborhood if at all possible. If you are able to cycle and you have a bike, go for a bike ride, leaving from your house and coming back to your house. I think that those are great things to do. And I am finding all new things to do in my house. One of the ways that I got out my stress today was scrubbing grout. So, whatever it takes, if you've got a few minutes that will clear your head and try to, it's an anxious time for a lot of the people in our community. And so it is important to take care of yourself. Always remember that 211 is a great resource. SoCoEmergency.org also has information around mental health and wellness. So, everyone, take care, and I will see you in a few days. Be well.